Hello, everyone. This is Kevin Morrison, Cook County Commissioner here in the 15th District. Thank you all for joining us here today for our town hall on problem gambling awareness. And I hope you have all been doing well. This past year has been tough, especially when it comes to mental health. Gambling isn't always top of mind when it comes to discussing mental health. So I'm grateful that the Kenneth Young Center and the Associates in Behavioral Health Care are going to help me raise awareness about when an activity can cross the line into addiction. We will share resources in the comments below. Please submit any questions you may have in the comments as well, and we'll answer as many as possible. With that, I'd like to welcome our great guest speakers that we have with us today. We have Marissa and Cole with the Kenneth Young Center and Mary with Associates in Behavioral Healthcare, who will present on problem gambling. What are the warning signs and how it affects your mental health? Thank you all for being here with me today. And to start us off, Marissa and Cole, let's have you lead the way.
Yes, thank you so much for that wonderful introduction. Thank you so much to everyone for being here. Cole and I have a presentation that we would like to share with you today about problem gambling. All right, so this is a little bit about the Responsible Gaming Grant at the Kenneth Young Center, also in collaboration with the Associates in Behavioral Health Care. So a little bit about the Responsible Gaming Grant. So the Responsible Gaming Grant in Illinois has been around for 19 years, but Kenneth Young Center, this is our first year. Our target populations include men of all ages, adults over the age of 55, adolescents between the ages of 14 to 26. And we'll get into a little bit more detail later on of why those are our target populations. We are conducting outreach work through Kenneth Young Center, such as providing resources for our community, whether it's through our Problem Gambling Support Resources Guide or our awareness campaigns, which can be found on our social media websites, as well as our billboards that we have several put up for Problem Gambling Awareness Month, featuring slogans, bet on a brighter future, and the hashtag that we have created, #BetOnYou. So what is problematic gambling disorder? So you kind of heard Kevin talk about it a little bit. So gambling addiction, also known as pathological gambling, compulsive gambling, or a gambling disorder, is an impulse control disorder. That means that someone really can't control their urge to gamble, even if they know that there could be negative consequences to that. This is a recognized addictive behavior as it stimulates the rewards and pleasure centers of the brain, very similarly to how drugs or alcohol might do the same thing. There's even research to suggest that when people even lose money in electronic gaming machines like the video slots, it can actually trick our brains into thinking that we are winning, which can make gambling a very highly addictive activity.
Thanks, Marissa. So now that we've talked a little bit about what problem gambling disorder is, what are some of the warning signs? So similarly with any other mental health issue, you can become disinterested in things that you previously took interest in and enjoyed, such as spending time with friends and family. So becoming withdrawn is one of the warning signs, as well as gambling can be a comorbid condition with things like substance use disorder. So using substances like drugs or alcohol. Selling personal items is another one. If you are suddenly, or a loved one is suddenly selling off that PS5 or a family heirloom that they hold near and dear to them to get money to pay off debts or to gamble some more, that's another warning sign. Ties into being secretive about money or finances, as well as borrowing or stealing money from friends and family.
So as Mr. Morrison had mentioned earlier, March is Problem Gambling Awareness Month.
Yeah, so some goals for this month include increasing public awareness of problem gambling. So thank you to everybody for having us here to talk about this. Training the general public and healthcare professionals about the warning signs of problem gambling. Raising awareness of problem gambling services available locally and nationally, such as ABC Counseling. Promoting resources and We Know the Feeling chat hotline for those struggling with a problematic gambling disorder.
So how to gamble responsibly. We would just like to acknowledge that gambling, can be a very fun, social activity when used responsibly. So some tips that we would just like to share with you all today. The big one that we've seen throughout all of our research is mainly to think of gambling as a form of entertainment and not a form of making money. That's really kind of when it can turn into a kind of problematic issue. Really only, setting a limit for yourself, maybe bringing cash only. That way you won't be, tempted to spend more than you can afford. Avoid using substances such as drugs or alcohol, which might impair someone's judgment. Taking breaks, that can be really important. I think I've definitely sat in front of a slot machine and kind of gotten in the zone. Taking breaks is very important. Not gambling when someone is emotionally compromised, if they're upset, maybe depressed, and balancing gambling with other activities in their life and never chasing losses. We hear a lot of times, someone might lose $100 and they say, well, I'm just going to gamble another $20 because I really need to win that $100 back. And that's when it can really come into that kind of negative cycle.
Yeah, so when gambling becomes an issue and somebody can't gamble responsibly, how can you help? So encourage this person to talk to a professional, suggest a SMART or other behavioral addiction counseling, or refer them to 1-800-GAMBLER or weknowthefeeling.org. And again, remember to come to them from a place of compassion, not stigma, and to let them know that you are there for whatever they need, wherever they're at.
Yeah, so thank you again also so much for your time. This is mine and Cole's contact information if you have any other questions. However, if you want to know a little bit more, really highly recommend checking out the National Council on Problem Gambling or weknowthefeeling.org. Thank you. And then I'm going to pass this off, to Mary.
Okay. Thank you so much. And I think we did you do this together. So some of our slides are very similar. And I think we just have the difference between what is compulsive gambling and what is actually responsible gambling. So I'd like to actually just start with thanking Kenneth Young Center. Thank you so much for including us. It was really great to be invited as a treatment professional. I have been a certified problem gambling counselor for the past 3 years. I've been doing gambling counseling for about 10. But to actually pass that certification and receive that acknowledgement was really in the past 3 years. So I think we're ready. If I can share my screen. Okay. Let's see if that worked. All right. So again, it was just a thank you presentation model. There we go. All right, next. Okay. And so what is gambling? I think sometimes people only see gambling as money, but there's other things that we actually gamble that is of value. And it doesn't have to be monetarily. Sometimes it's really taking the time it takes to gamble that can have the significant negative effects. The other thing that I just wanted to talk about is it was moved as an addiction in 2014. The DSM is actually the medical criteria for all mental health problems. And so in 2014, they actually moved it as a behavioral addiction. It really shows that, like Kenneth Young Center said, that gambling is very similar to all substances. It's also in the clinical expression. It is the way our brain chemistry change, comorbidity, and actually how we do treatment. So some of the things that we do with treatment is actually we work with cognitive behavioral therapy. We also do motivational interviewing and really talk about how maybe this use of your money affected your family and yourself. The questions that I ask people, it's called the lie bet, and it's a very quick questionnaire. Of course, the first one here is in the past 12 months, do you become restless or irritable or anxious when you're trying to slow down gambling? Or let's say don't have any finances to gamble, or you're thinking about how much you've just lost. But the two questions for the lie bet is, have you ever had to lie to your family members or your friends about how much you're gambling or how much you lost? Or isn't it funny that we talk about how much we won, but we never say what it cost us to make that winning? The second of the lie bet is actually, have you ever had to increase how much you bet? And is it affecting your living expenses? And so it's actually called the lie bet. Like we talked about, it is March is of course March Madness. It's a very big entertainment in the basketball world. And I think that one of the things that we want people to know is that calling the 1-800-GAMBLER hotline, 13,000 people have actually reached out in between 2019 and 2020. So that is a great deal of number of people are actually calling. And I thought I could just bring it kind of home. I picked the towns surrounding Schaumburg only because just to compare it. You know, one of the things is Schaumburg's kind of new to video gambling. And it might be, I'm not sure the reasons why, but our household income in Hoffman Estates is about $91,000 per household. And per capita, it's $39,000. In 2019, we had 150 machines. And in 2020, we had 162, or I should say they had, Hoffman Estates. But if we really look at the numbers, so with 162 machines, and if we go to the left, in 2019, those machines earned $9,452,000. I'm talking about in 12 months in Hoffman Estates alone, out of 162 machines. And now when I say the machines earned, I think if I come back, I'd like to be a video gambling machine, because truthfully, you put $10 in, you get 9 back, the machine earned $1. So the $9 million was actually how much was left in the machine when the person walked away from the machine or people walked away from the machine. Of course, COVID hit. So you know what happened. 2020, the machines made less. They only made $6,693,000. And now that's just in Hoffman Estates. And of course, as we all have budgets, I'm sure that every city or town or municipality is looking at how much they can actually earn from these machines, and then that would go to their town budget. So Hoffman Estates actually lost $172,000 in 2020 due to the machines being not operable during COVID. So then I thought I'd go to Elk Grove Village. Elk Grove Village, the per capita income is $91,000. I'm sorry, the household income is $91,000, and per capita is $41,000. In 2019, Elk Grove Village alone made $9,392,000. I'm sorry, the machines made that. So how it goes is actually the state gets 20%, the village or the town gets 5%, and then 35% goes to the owner of the machine, because it's not always the business owner, and the business owner gets 35%. And that, of course, equals your 100. So in 2020, the machines earned in Elk Grove Village $5 million. And these statistics, you can actually go look at the Illinois Gaming Board, and it will actually tell you for everything. We'll talk about sports betting. It'll talk about casinos. It'll talk about video gambling. You can actually put in and know exactly how much money was made on each establishment or each month or each year. In Schaumburg, you know, for Schaumburg, they had a 7-year ban that actually ended on September 25th. On December 17th, they awarded 45, or I should say the 45th machine. Many of these new licenses were just issued at the end of the pandemic, and the machines in Schaumburg earned $100,000. And so it is because we've basically been closed. But I don't want to just focus on our machines, because really this is Problem Gambling Month. Online sports betting is now legal. Our Super Bowl bets, just in Super Bowl, this last Super Bowl, it was a great game, was $4.3 million in the United States. March Madness is expected, and of course, we're not sure yet, because that will start in a few weeks. We're estimating approximately $10 million will be waged. Now, we're talking about professional online, $10 billion will be raised, but we're talking about professional, legitimate gambling. We're not talking about the office pools or sitting around your family and you're going to say who's going to win, and maybe you're going to bet maybe dinner or something on it. We're talking about how much is actually logged into our gaming sites. We also have sports betting. Do you know in 2020, $1.9 million was waged during that time? I'm so sorry. I keep saying million. It's actually billion. 1.9 billion. That's a lot of money right there just on our online betting. And this money is actually being gambled away. And revenues are actually, I'm not sure how they know what state would be awarded their share of the funding of this. But if we talk about local, let's go local and go on the bottom to our casinos. In 60 days, from January 1st to March 1st, Rivers and Des Plaines earned $37 million. Grand Victoria, 12 million. Now, I actually have an office right there in Schaumburg. I'm on the corner of Schaumburg and Meacham. And to actually think that $50 million was actually left in these casinos, I am kind of amazed, because that seems to me a lot of money that the casinos have actually been able to, let's just say, taken from our residents. But now we have cannabis. And of course, with cannabis in May in 2020, they were going to award up to 75 licenses. And this year, they're going to award another 110 new licenses in the state of Illinois. A license costs the applicant $5,000, and if awarded, costs an additional $65,000. So our state actually projected, because they did have to figure out how much they would anticipate, their income for fiscal year 2020, which started July of 2019, was to be $57 million. But they've only earned $52.25 million. And remember, these are what's actually being bought in the stores. And I'm not saying that there are people that are buying from their friends, but that would not be included in these numbers. I think the recreational cannabis, actually the tax rate is 10% of the sale. 35% goes to the Illinois General Revenue Funds that will help us in all different areas of our life. 25% go to criminal justice projects. And 20% will actually go to the Department of Human Services, the Substance Use and Prevention Recovery Act for treatment and prevention. And if I were to actually just compare the two, so we're spending 20% of the income of marijuana for treatment and 35% for research on criminal justice, and that is just for marijuana. And if we're looking at gambling, the state is only awarded 1% for treatment. So if you do need help, please talk to a treatment professional. I suggest Gamblers Anonymous. I think there's nothing better than having peer support and knowing how someone can actually feel when they walk in, and perhaps maybe a little shame, and be rewarded. Of course, we know the feeling is the Department of Human Services website. It has so much information. It has free workshops. You can go listen to some of our old ones, and you're really going to learn a lot. So I think our offices we have in Schaumburg, I have Roselle, I have St. Charles, I have West Dundee, and actually this is March Madness. So we are offering free problem gambling screenings every Friday in March from 10 to 1. Now, I'm not just limited to this time. Please call me. I have a whole program in Spanish. I have Maria Rodriguez. She's actually on the back in case there's any questions as to her population that she actually serves. We do all of our services in English and in Spanish. And our contact information, I think if you really want to learn more, I have to tell you, the Illinois Council on Problem Gambling is an excellent resource. It's in Southern Illinois. It's been around for about 20 years. We also have the National Council, and we know the feeling. Thank you so much. We lost our moderator.
I think we did.
We did. Oh, Kevin. I thought we lost you.
With all that data.
It was a lot. It was a lot. But you know, the Illinois Gaming Board has all your statistics. And you know, to me, that's a lot of money. Yeah. $50 million in 60 days. Now, you know, we've all been in a bubble. So we all needed some entertainment. And I think the casinos are a great place. You can get some dinner. You can watch maybe a show. I don't know if they're doing any more of those shows, but there used to be some great entertainment there.
No, I gotta say, thank you all for your presentations, especially Mary. I'm a data nerd. I love seeing that. I would love to get the link to do my own investigations. You know, in my own personal network, I know folks who have dealt with issues when it comes to gambling. And with me, I'm just too fiscally conservative. I don't like wasting my money. I don't even like going shopping for personal items. I only buy food. But no, I think this is fascinating, and I thank you all for joining me in this conversation, and definitely taking steps to bring more awareness during Problem Gambling Awareness Month. Again, to all of those who are watching us today, if you have any questions for any of our incredible guests, please put those questions in the comments and we'll be happy to address them. To start off, I do have a question for Cole and Marissa. how did electronic gaming machines begin in Illinois? How did this process start?
Yeah, so that's a really good question. So in 2009, the Video Gaming Act was passed into law, which allowed video gaming terminals to be placed in liquor and licensed liquor pouring establishments. So Mary touched a little bit on this too. Since then, they've grown exponentially. As you see the rise of so-called like backdoor or mini casinos. You probably know them as like Dottie's, Mays, Shelby's. You see them popping up a lot. But more than 32,000 video gaming terminals generated $478 million in revenue for the state and local governments in fiscal year 2019. So by population, Chicago is the third largest city in the United States. And as of 2019, Illinois has the most gaming machines, more than any other state, with over 30,000 in roughly 7,000 locations. Nevada, for example, comes in second with 18,000 in roughly 2,000 locations. So it's a pretty interesting statistic.
More than Nevada. That's crazy. Wow. Marissa, do you have anything that you would like to add to that?
Yeah, I would just like to add on, there has been like this explosion recently, especially we're seeing like in Schaumburg, like Cole had said, the rise of electronic gaming machines. And now, you know, people don't even have to make it all the way to the casino. They can, you know, walk to their local strip mall and find one of these electronic gaming machines. So I think that the convenience factor is also playing kind of a hand in some of the problematic gambling behaviors that we have been seeing.
That's so curious. That's so curious. I would definitely, you know, just seeing how much these locations are earning in the millions of dollars, I would be very curious to know what the average staffer at these locations is making. So if any of you is privy to that information, I'd be curious down the road. Mary, I had a question for you. What are some of the ways that different levels of government play within gambling, within the gaming industries?
Well, you know, that's a difficult question because I think we're all looking to increase our budgets, and we have so many needs in our communities. And so it is looked at as being an income stream. And I can understand Schaumburg saying they're in Hoffman Estates, they're in Elk Grove Village. Why should our Schaumburg residents go elsewhere? You know what I mean? I can understand that. But I think one of the things that there was an analysis made that actually found the number of machines increased as the average income decreased. So if you actually look, so your towns that have the highest income have the lowest amount of machines. And I could be wrong because I haven't really done much research, I'm sorry to say, if City of Chicago actually allows video gambling yet. I do believe that they didn't for a long time. And so,
Yeah.
you know, Cook County, I'm not really sure why the City of Chicago says not here. And that might make up a big idea for them because, hey, they'll come right out to Schaumburg because we're right located at 90 and 53, and we're very conveniently located. So the other thing that I really wanted to talk about is there's a National Council for Problem Gambling, and the executive director, Keith White, he actually wrote an article that talked about if the purveyors of the gaming industry would look more closely at their clientele that they have so hard to gain, because truthfully, you know, it's hard to gain a client. We're all out marketing, looking for clients. So are they. You know what I mean? They do a lot of promotions. They do a lot of materials and offer different specials and everything they have to do to gain a client. But he actually said, if they would take a little more looking at their client to be more longevity, to be able to last longer, because a person, I only have so much money in the bank. I only have so many friends that are going to loan me money. I only have so much of a credit rating. And once it's gone, it's gone. I can't go back and get that student loan back that I had for my kids, or the student, you know, the savings account for college. And when my 401 is gone, it's gone. There's no more left. So there's an end life to our customers, shall we say. And so what Kevin White said is, if they would learn how to sustain their customers longer, they would still get all the money they would get from a person. It would just be longer. And he was talking about if there was limits, you could only sit at a machine for, let's say, 4 hours, 3 hours, 2 hours, 10 minutes. And all of a sudden it'd be like, okay, I'm sorry, you need to get up, or maybe move a machine, or maybe you could only do a certain amount, or maybe there was a limit on how much you could spend. I think the other thing that we've talked about as far as in the gaming commission, and I should say the Illinois Gaming Board, was actually asking if we should have a card like they do in casinos. So in casinos, you actually go in, you have to present a card. They know who's there. They know how long you've been there. They're tracking what you're spending. It's your reward systems. You can get some free buffets. But what if you had that in video gambling? Now, people have said they don't want that because they don't want someone tracking how much they're putting in machines. So I think that's what I wanted to say to government officials is, how can we make sure that it's entertaining? How can we make sure that you're not spending your last $10 that would have went to your child's lunch money as opposed to hoping that you're going to have a great windfall?
So incredibly curious. Wow. And Mary, we have a question that just came in from my good friend Shireen. And Shireen, I pray you're doing well and keeping healthy. The question is, Mary, do you see the issue developing with teenagers?
Oh my gosh, yes. Teenagers. I currently am working with a family whose son was actually right there in our local high school. He was a football player, went on to college to play football on a scholarship. He actually came to see me because he was so far in debt and there was no more loans available to him. And he actually went to college and his goal is to actually work in the sports arena. He actually talked about in high school how much they were gaming and gambling, the kids in school. And so we're talking about it starts very young. It starts probably when we're talking about process addictions. We're talking about screen times. I remember when I was a kid, my mother would say, oh, you don't sit close to the TV, or you can only sit there for an hour. And now maybe we're giving our youngsters computers, phones, tablets as entertainment, and it's really moving them into the gaming platform. How many hours do some of these kids spend gaming? And that actually moves. And some of these games are made to look like you get points and you win, and it really just feeds you.
I want to ask a follow-up question too. And, Cole and Marissa, jump in if you have any information on this line. I used to see this more back when we actually saw people in person. So I haven't seen it recently. But isn't it true that there are cell phone applications where you could actually be gambling now? And how do they verify the actual age of the individual who owns that cell phone?
That's a good question. I believe that the Illinois Lottery even has an application that you can use to go on, and you can even read your ticket numbers through the app. From my understanding, I would have to go back and look at it. There is just like I am 18 verification box, and really all you need is just like a usable credit or debit card.
Fantastic. Well, I believe I actually got a question for myself. Usually folks don't ask me the question. They always ask our panelists. But we got a question that was whether or not I'm concerned with the rise of online sports and fantasy sports gambling, and about day trading apps like Robinhood, which mimic gambling apps in how they operate. What I will say is, I want to make sure that all my constituents are whole. And so if that means fighting so that they have a living wage, that is what I'm going to advocate for. And if there are issues in terms of potentially having addictions such as gambling that are hitting at their bottom lines, I believe we need to do whatever we can to make services accessible to help deal with those main issues. And so I believe there's a lot of work to be done on a lot of fronts. I'm very passionate about seeing more accessibility when it comes to mental health. I've been working hard to try to get our mental health population out of the jail and into a place where they're dealing with medical professionals to get services, to get access to a continuum of care, housing, and jobs, being able to return to become more proactive members of our society. And so, yes, I do have concerns, and I believe that there is a responsible manner to do all activities, whether or not that's from gambling to drinking, and making sure that individuals who are dealing with issues in those areas, being able to provide the services and connections that could help them get on a better path forward. And so that's how I would respond. Are any of you, I've never used Robinhood. Have you heard any issues with Robinhood? I'm going to just throw it out to our whole panel.
We haven't, I haven't personally used it or heard of it too much, but we have had conversations lately about the, similarities between investing in the stock market and gambling. It's very similar in a lot of ways, but looked at very differently. So we've definitely had those conversations lately. It's an interesting parallel.
Yeah. Well, I learned of Robinhood when it ended up in the news and everyone was buying GameStop trade.
Yes. Yes, I think that's it. That's about when it really came to the forefront. But there's a lot of these apps out there. And I think that's it. I think that we have to watch what we do, but also what our family members do.
Yeah. No,
I think we have to almost protect ourselves. I know one of the questions that Kevin, you asked right before was about how family members and bystanders and coworkers can actually help someone. And, I have to say, the people that I've worked with have been devastated. I know one lady I just worked with recently, she said, I didn't know my husband gambled until the sheriff was at our 4-bedroom home and it was eviction and our stuff was being thrown out. And I had to tell my kids, had no idea. I thought he was doing so well. I had no idea the college funds were gone, the 401s were gone. And so maybe it is about, if you're seeing something different about your spouse, check on it. Some of the other things that I work with spouses is, hey, check your credit line. Everybody can check your credit line. If you got some credit cards that you didn't apply for, you know what I mean? Maybe that's a warning. I remember one lady, one gentleman came in and he said, okay, I need help. I need my wife to trust me again. And I said, oh, okay. What's the issue with trust? He said, I quit gambling 2 years ago. And then I won the big trifecta, and we happened to be at Arlington Park Racetrack, and my picture went on the screen, and she was standing next to me as the big winner of the trifecta. And I just kind of was taken back and thinking, oh my God, you lied to her. And she found out in front of a room full of people, how do you rebuild that trust? And trust is hard. I think, if you're an alcoholic, you probably shouldn't be a bartender, right? I mean, you probably shouldn't be pouring mixed drinks for other people. And so if your issue is your use of money and your finances, maybe you shouldn't have access to the whole family financial picture.
Yeah, I agree. And we got another comment in that just brought up that sad story about the youth who committed suicide because he mistakenly thought that he owed Robinhood $730,000. I saw that myself, and I read that story, and it's heartbreaking. And so I'm going to connect that in with my next question with Cole and Marissa. What are some of the more successful messages that have encouraged people to seek help?
I think too, just really quick, kind of touching on what Mary had brought up with that story, was it's important to recognize too that we often hear gambling is a hidden kind of disorder. So it's important to remember how it works comorbidly with other substance use disorders. So if somebody's dealing with a substance use disorder, maybe pull back the curtain a little bit more and see if there's something else going on there as well, so that you can kind of, get them the help that they need as well. So just wanted to add that in too real quick. Sorry. But
of course.
Yeah.
No, that's perfect. Also, suicide, the highest rate of suicide is among gambling disorders.
That's mind-blowing.
Sorry, go ahead.
No, please, Marissa.
Oh, I was going to say, in terms of effective communication with other folks, like Cole had said, gambling is often referred to as a silent or a hidden addiction, because unlike maybe someone who's using drugs or alcohol, it can kind of be hard to catch some of those warning signs. So a lot of times, people dealing with any kind of addiction while they're in recovery can feel very isolating and, feel very lonely. And especially when you add, the coronavirus on top of that, when we can't have those face-to-face interactions, we've really been trying to stress the importance of community recovery and community care, really reaching out to folks and letting them know that they do not have to deal with these kinds of issues all by themselves, and that there are people who are able to, provide resources for them. So on our social media campaigns, as well as several of our billboards, we have a message or or a slogan that reads, odds are better when we recover together, really emphasizing that community care aspect. Because if people feel shame, stigma, if they feel like they're the only ones out there who are dealing with something like that, it might be a lot harder for them to reach out and to get help. We often see, I've seen other gambling billboards or messaging, they feature someone has their head in their hands, they're alone, they're obviously very, distressed and upset, but we're really trying to kind of move past that initial devastation point and have them look towards the future. And really, when you're with people and you have that support, you can recover and you can do anything.
Wow. No, that's an incredible message. And thank you for sharing. And, I just, a lot of what has been brought up in conversation just has my mind going in multiple directions. But, I want to go back to what you said earlier, Mary, about the wife who didn't know that her husband had a gambling issue until, the sheriff was there serving an eviction notice. That just blows my mind. And I recognize that when it comes to substance abuse disorders and the like, there can be more visible signs. Have we noticed yet in the study of problem gambling, are there any signs to look out for that we've been able to identify?
I think a big one is usually the mail stops coming. And so when all of a sudden there is no mail, and you're also going to see a lot of different gaming establishments send you flyers, so you have an increase of those, and then maybe the other mail has been changed for different places. I think the irritability and when they stop wanting to do other recreational activities. I'm not really sure how it goes anymore, but I think when I was a kid, they told us 20% was supposed to go for your house and 20% supposed to go for your medical and your car. And, entertainment is supposed to be like 5 to 7% of your budget. And so I think when we don't have the money to go around to all of our other needs, that's when it should be a problem.
Yeah. Wow. No, thank you for that. Thank you.
How about an open conversation? Say, hey, I noticed there's a new place down there. I will have to say we did an exhibit one time, and it actually said free popcorn put on by gambling treatment. You know what I mean? And so people would come up because free popcorn, everybody comes to your booth. And then we actually had in the town all the income made by certain establishments. And I remember the one guy walked up and demanded I take it down because it showed that but this establishment made over $150,000. And he was telling me how bad it was that I was advertising this. And I said, Illinois Gaming Board, look it up. And so I kind of laughed later and I thought, you know what? I think he was the owner of that bar. But then a couple other people would come by and be like, and one guy was dragged by his wife. How much of this is your money? How much of this is our money? And I'm thinking, you know what? It's really out there. It's really out there.
Wow, that's unbelievable.
I think the statistic is 6 seconds to hit the button. Whether you're playing for a penny, 6 seconds. You know what I mean? Times 60. You know what I mean? If you're playing for 2 cents, it's very quick.
Yeah.
It's quick.
Wow. Oh, I would have. That would have been an experience being at that table and witnessing some of those conversations. Cole and Marissa, I have a question for you too. As we are hopefully seeing a light at the end of the tunnel with COVID, is there hope that as some of these stressors are alleviated, that, we won't see as much of an issue when it comes to problem gambling? And also, I want to ask, is there preparations underway at Kenneth Young for doing more outreach once being more so in person is going to be accessible again?
Yes, so we are really, really hopeful that within the next year, we can actually get out in the communities and interact with our community members. Touching on you asked a little bit previously about, what the trends might look like after, a lot of more people are vaccinated. I don't know. And I'm very interested to see what that will look like. We are seeing a trend of gambling apps moving more online and, not as much as the traditional casinos or lotto tickets, but instead, sports betting online through online gaming. So it'll be very interesting to kind of see what happens once we are allowed to go back into the public. As far as our outreach, we would love to get out back into the communities. We had talked a little bit about how older adults are a part of our target population. We would love to reach out to senior living communities, assisted living communities, because we kind of have a joke in our division that we are not in the business of prohibition, but the business of prevention. So even just getting out to people and educating them on how to gamble responsibly, and, you know, maybe to look out for some of those warning signs. So really want to focus on kind of those growing problem gambling populations, as well as healthcare professionals. Really, if we can get out to other kind of tabling events and reach out to these healthcare professionals personally and just let them be aware and let them know what warning signs to look out for. And then, you know, with their own practices, with their patients, they can take that information and hopefully be able to either refer them to a specialist or at least be aware of it and then able to have a conversation with their patient if they feel like this might be an issue. Also thinking about, we've been able to work pretty closely with some of our youth advisory councils, which are made up of high schoolers at Kenneth Young Center. So we've been having some virtual discussions, but if we can get into the schools next year and just make young people aware of problem gambling, I think that that would be a huge service. Mary touched on it a little bit early, talking about teenagers, and we are seeing this trend of teenagers, you know, moving online. So whether it be the sports betting or the online gaming, and just giving them some things to look out for, because the people who design these apps or the people who design these in-game purchases are really, really good at making these kinds of purchases or activities not look like gambling. So we're really looking forward to that next year.
I appreciate you bringing that up. You know, just like how students in high school have to learn how to balance a checkbook, even though most of us don't have checkbooks anymore, providing some information on how to keep some cash in that debit account is also some great advice that folks should be learning. I like it. Cole, did you have anything that you would like to add to that part?
Like Marissa touched on, we would love to get into like senior living communities, because, you know, with our older population that are living in these communities, these places will often drive their residences to casinos, you know, and it's something that's very easy for them to do. They can sit, they can, you know, be in air conditioning, and it's real easy for them. And so giving them the tools to do it responsibly would be very important for us to do. So.
Oh, geez. And I bet, especially with those cell phone applications, there's a link with, you know, the apps that they've had previously where you didn't have to spend money, and how the platforms are similar. See, with me, I don't play games on my phone. I have a news reading addiction. That's my addiction I need to help with. I need more time in my day not reading all these news apps. But Mary, I wanted to ask you too, have you noticed more people seeking help while they've been staying at home more? Has there been more demand?
There has not been more demand in any of our services, especially with our youth. We have a youth drop-in center in Roselle, and even the kids don't even want to come and have fun. So I think that it's really coming out, and I think it's more of a silent epidemic, as we've all talked about. But I do see it with things back opening up. One gentleman I just worked with this week, he said in the last 6 weeks, he lost $10,000. And the reason why, it was because the video gambling's opened up. He was doing really well for the 6 months they were closed, but then he got back into it and was missing it. And so I think it's going to hit us really hard as we're opening up.
Oh, geez. Well, I always try to remain hopeful and pray for better days ahead. We did get a comment. You know, this is news to me, and I'm not sure if Kenneth Young, but maybe Mary, your organization has a more of an advocacy arm when it comes to policy. But apparently, Illinois legislators are considering making casino-style gaming legal online. Have you heard of this? And is there, you know, conversations going on about that topic?
Yes, actually, wouldn't it be nice that you could actually play roulette on your phone? You know what I mean? You won't even have to go anywhere, or poker, or blackjack, or it is something that they're talking about. Our agency doesn't have an advocacy role, but there is the Illinois Alcohol and Drug Addiction Performance, actually professionals. Also, we have our certification board that does a lot of advocacy. So, and I'm sure that the state, the Department of Human Services, and our substance use and prevention and recovery program actually does more advocacy. And I think right now what's really important is there is a new survey going out. First time in 30 years that the state of Illinois has actually looked at what is the outfall or outcome of gaming and gambling. And so that survey is going out. So if anyone kind of sees it, please take a part of it. I think you're really looking to see what is with gambling. And the last time we did it was when the lottery first came out. And we haven't actually, Illinois hasn't looked at it since. So that's 30 years ago.
Wow. Incredible. Well, I'm glad to hear that they're taking moves to do that survey. Definitely many fascinating topics and new information that I've even learned today. Unless any of our viewers have any questions, I think I'm done with my portion of questions, but I do want to go around the horn again and allow each of you to share any final thoughts, recommendations, and the like. And maybe we'll start with you, Cole.
Yeah, I mean, I think we covered a lot. I don't really have anything else top of my mind to add. Not sure if Marissa or Mary.
Yeah, I would just like to echo, Kevin, you had mentioned just how actually interesting this topic can be. Cole and I attended some trainings before we started this grant, and really gambling addiction is a lot deeper than I think a lot of people realize. And it is, really a silent epidemic, kind of as Mary had said. So the fact that you are putting on this, town hall meeting just to raise awareness, I think really changes a lot. So I want to say thank you for allowing us this opportunity.
Well, happy to do so, and always glad to partner with the Kenneth Young Center. You guys are great, and we're lucky to have you. I grew up in Elk Grove, so I was right down the street from Kenneth Young. Mary, thank you again for being with us. Any final thoughts, recommendations you would like to share?
I'd just like to thank both you and Kenneth Young Center. I appreciate being included, and there's help out there. 1-800-GAMBLER will always seek you direction. We know The Feeling is a website, all the programs that are listed. The treatment is actually free if you cannot afford a treatment. You don't need insurance. Give us a call. We're doing free screenings. I think there we go. That's perfect up there, our little banner. Thank you so much, Kenneth Young Center. I really appreciate being invited.
No, of course. Thank you all for taking the time for being with us today. I think some of our takeaways, if we have loved ones that we have the feeling impression that they might be dealing with an issue, finding productive ways to broach that conversation and try to suggest that there are programs out there and groups that are happy to help. And so wishing everyone out there health and safety in the days ahead. And, in the end of the day, we want to make sure everyone's staying whole. So anything could be abused, and we just got to make sure that we are always making sure that we are doing whatever we're doing in the most responsible manner possible. So thank you all for being here. I really appreciate it.